Welcome to Dr. Ravichandra official YouTube channel exclusively for pathology. In the last video, we have discussed what is inflammation, what are the signs of inflammation, and what is acute inflammation, and what are the types of acute inflammation or subtypes of acute inflammation. In this video, we will exclusively discuss the components of inflammation. The main components of inflammation are two. One is vascular event and the other is cellular event. Vascular events include first one, transient vasoconstriction of arterioles. Second, persistent progressive vasodilatation. Third, elevated local hydrostatic pressure. And fourth, the most important one, increased vascular permeability. And the last but not the least, slowing or stasis. So total five vascular events are there in any inflammation. One is vasoconstriction, then progressive vasodilatation, then increased hydrostatic pressure, and fourth increased vascular permeability, and fifth slowing or stasis. Vascular events. As I said, there will be transient vasoconstriction in the first stage. Then there will be persistent progressive vasodilatation. Because of this persistent progressive vasodilatation, we will have the cardinal signs rubor and color, redness and rise of temperature. Next event, elevated local hydrostatic pressure. This will result in formation of exudation of proteins, transudates. As a result, there will be a cardinal sign swelling, humor. So in this picture, you will be able to appreciate that there is increased hydrostatic pressure and there is decreased colloid osmotic pressure, thereby causing the leakage of the proteinaceous fluid. Increased hydrostatic pressure because of the venous outflow obstruction, example congestive heart failure, and decreased colloid osmotic pressure because of the decreased protein synthesis like in liver disease or increased protein loss like in kidney diseases results in formation of a proteinaceous fluid accumulation called as transudate, which is very low in protein content and there will be very few cells. In a exudate there will be high protein content and it may contain sometimes white blood cells also and red blood cells. There will be vasodilatation and stasis and increased interendothelial spaces resulting in inflammation. So transudate is having low protein content and few cells, whereas exudate will have high protein content and few red blood cells and white blood cells. All this phenomena of the inflammation is because of the increased hydrostatic pressure and decreased colloid osmotic pressure resulting in leakage of the plasma proteins. Increased vascular permeability is the main or characteristic vascular event in inflammation. It does not occur through normal vascular endothelium. It results in formation of or leakage of the proteins, high proteins. So it is a exudate resulting in swelling, humor, cardinal sign of inflammation. There will be transmigration. Increased vascular permeability happens through various mechanisms. First one is endothelial gap formation will be there. Then or there will be direct endothelial injury or leukocyte mediated endothelial cell injury or increased transcytosis or leakage from new blood vessel resulting in increased vascular permeability. Endothelial gap formation is the most common mechanism which results in increased vascular permeability. It is rapid, short-lived, and it will affect the venules. The components will be histamines, leukotrienes, bradykinins are involved in endothelial gap formation. Direct endothelial injury resulting in increased vascular permeability is seen in necrotizing injuries. It will affect the capillaries, arterioles, and venules. It is very fast and long lived. It lasts hours to days. Leukocyte mediated endothelial cell injury resulting in increased vascular permeability. It affects mainly capillaries and venules. It is a late response lasting for hours to days. Leukocytes will adhere to the endothelium and release tissue oxygen species, free radicals, which will cause the endothelial damage. Increased transcytosis resulting in increased vascular permeability occurs along the channels, vesiculo-vacuolar channels near the intercellular junctions in venules, and the growth factor that is involved in increased transcytosis is VEGF, vascular endothelial growth factor. Leakage from the new blood vessels resulting in increased vascular permeability. It is a late response and it occurs during repair. Histamine, substance P, and vasothelial or vascular endothelial growth factors are involved in this process of increasing vascular permeability. Coming to the last step, slowing or stasis. This is the last vascular event in inflammation. It occurs due to increased viscosity of a blood as a result of the exudate or fluid exudation, and it takes 15 to 30 minutes after inciting the stimulus. Stasis of this blood leads to margination of the leukocytes. Generally, leukocytes will be flowing in the center of the blood. With this stimulus or slowing or stasis of the blood, the leukocytes will marginate towards vascular endothelium. Now we will discuss the cellular events that are involved in inflammation. Again, this includes margination, rolling, adhesion, diapedesis, chemotaxis, and finally phagocytosis. So this is a cellular event. So this is the leukocytes are involved in this event. So first, margination. Due to stasis, leukocytes will marginate to the periphery of the blood vessels. Leukocytes stumble on the endothelium, adhere, and firmly attach to them. This is called as margination and pavementing. Slowing and stasis, central stream of cells widens, loss of plasma by exudation, resulting in peripheral plasma zone becoming narrower. A result of this, as a result of this redistribution, neutrophils in the center column come close to the vessel wall, and there will be reversal of the axial blood flow, thereby margination and pavementing. Next, after margination or pavementing, attachment of leukocytes to endothelium will occur with the help of selectins, integrins, and immunoglobulin superfamily. Attachment of the leukocytes to endothelium with the help of selectins. There are three elements come under come under the selectins. One is E-selectin, that is present on the endothelium, P-selectin, that is present on the platelet, and there is a glycoprotein cell adhesion molecule, CAM, cell adhesion molecule, GCAM, glycoprotein cell adhesion molecule 1. So the E-selectin present on the endothelium will combine with the or attach with the sialyl Lewis X receptor on the neutrophil. P-selectin on the platelets will attach with the sialyl Lewis X receptor on the neutrophil. Glycoprotein cell adhesion molecule 1 will attach with L-selectins present on the leukocytes. Coming to integrins, there are two integrins involved, beta 1 integrin and beta 2 integrin. Cell adhesion molecules like ICAM, intercellular cell adhesion molecule, and VCAM1, vascular cell adhesion molecule 1. The intercellular adhesion molecule ICAM will attach with beta 2 integrins, and vascular cell adhesion molecule 1 VCAM1 will attach with beta 1 integrin. And the immunoglobulin superfamilies that are helping in the attachment of the leukocytes to endothelium is, as I said earlier, ICAM1 and VCAM1 and glycam1. CAM means cell adhesion molecules. So this is a picture showing how a leukocyte will marginate and pavement and attach to the endothelial or platelet. There will be sialyl Lewis X modified glycoprotein will be present on the leukocyte. There will be integrin on the leukocyte. E-selectin will be present on the endothelium and P-selectin on the platelet. So the leukocyte will, with the help of the sialyl Lewis X modified glycoprotein, will attach with the E-selectins and P-selectins, and the integrins when attached results in high affinity state. The integrin ligands will be, that is immunoglobulin superfamilies will be ICAM1, VCAM1 and PCAM1. PCAM1 is also called as CD31. They will helping the leukocytes to attach to the endothelial walls and penetrate or transmigrate into the cells, thereby causing release of the chemokines, which will increase the flow of more and more leukocytes to the site of inflammation, chemokines, and will attack the microbes. The cytokines are released from the leukocytes, and thereby this process of cellular and vascular events will combinedly result in inflammation. So selectins and integrins or cell adhesion molecules can be given for 3 marks question. Altogether can be given under 6 marks question. So P-selectin is a platelet selectin. Okay, it will combine with sialyl Lewis X modified protein, helping in rolling of the leukocytes, mainly neutrophils, monocytes, and T lymphocytes. E-selectin that is selectin on the endothelium, attach with CLA-Lewis X modified proteins and on the leukocyte molecule and results in rolling and adhesion of leukocytes, neutrophils, monocytes and T lymphocytes. Glycoam 1, glycoprotein cell adhesion molecule 1, also called as CD34, will combine with L-selectin leukocyte selectin and results in rolling of neutrophils and monocytes. Immunoglobulin cell adhesion molecule 1 also combines with integrins beta 2, CD11 or CD18, resulting in adhesion, arrest, and transmigration of the neutrophils, monocytes, and lymphocytes. VCAM1 immunoglobulin family will combine with or attach with beta 1 integrin of leukocytes and help in adhesion of the eosinophils, monocytes, and lymphocytes. Remember, VCAM1 and beta 1 integrin help in adhesion of eosinophils, monocytes, and lymphocytes. ICAM1 and beta 2 integrins adhesion or attachment will help in adhesion of the neutrophils, monocytes, and lymphocytes. PCAM1 is also known as CD31, and there will be transmigration of the leukocytes called as diapedesis. Transmigration across the endothelium under the influence of chemokines is diapedesis. CD31 PCAM1 located on the endothelium will help in this diapedesis. Leukocytes will pierce the basement membrane with the help of the collagenases and bind with the extracellular matrix with the help of the integrins and CD44 on its surface. Chemotaxis, the process by which leukocytes travel towards the focus of injury under a chemical gradient, is called as chemotaxis, and the chemicals are called as chemoattractants. These chemoattractants can be bacterial products or complement proteins C5a, leukotrienes, chemokines like interleukin 8, which will cause receptor activation of the leukocytes, which will result in change in actin myosin complex in a cell, leading to pseudopode formation, which will help the leukocyte for locomotion towards the site of injury. The final step, that is phagocytosis. This is the final cellular event in a inflammation. Phagocytosis is a process by which leukocytes and macrophage is nothing but monocyte, will secrete enzymes for elimination of the microbes. And this phagocytosis involves three steps. First, recognition and attachment. Second, engulfment. Next, killing and degradation. Recognition and attachment. Leukocytes and histiocytes or macrophages recognize the microbial particles with the help of receptors on its surface. Then there will be opsonization. Opsonized bacteria are easily recognized and firmly attached by the leukocytes. C3b receptor and C3b opsonin. IgG opsonin. Next, after the opsonization, there will be engulfment. Leukocytes send pseudopods around the microbe and engulf it to form a phagosome. The phagosome will bind with the lysosome to produce a phagolysosome. And the final step in phagocytosis is killing and degradation. It will occur by two mechanisms. One is oxygen dependent and the other is oxygen independent. Oxygen dependent phagocytosis killing and degradation will occur with the help of hydrogen peroxide myeloperoxidase allied system. In this process, the neutrophil granules will release the myeloperoxidase enzyme. Hydrogen peroxide is converted to hydroxyl ions, and release of the free radicals will degrade the microbial proteins with the help of free radicals. Oxygen independent killing and degradation of the microbial organisms. Neutrophil granules will release a major basic protein MBP, lactoferrin, and lysozymes which activate the phospholipase enzyme that will degrade the phospholipid membrane of bacteria. So, phagocytosis can be oxygen dependent or oxygen independent. Oxygen dependent is associated with hydrogen peroxide myeloperoxidase allied system. Oxygen independent will be happening with the help of major basic protein lactoferrin and lysozymes which will activate the phospholipase enzyme that will degrade the phospholipid membrane of the bacteria. So this is a picture showing phagocytosis. Phagocytosis can be asked for a 6 marks question. So there will be receptors present. With the receptors, opsonization will happen. Then there will be phagolysosome formation because of the pseudopods. Then phagocytosis will occur. Killing and degradation of bacteria will be happening at the final stage. So first one is recognition and attachment. Microbes will bind to the phagocyte receptors. Then the phagocyte membrane zips up around the microbe. Engulfment will happen. Thereby the phagosome with the ingested microsome will be combining with the lysosome with enzymes and resulting in fusion of the phagosome with the lysosome resulting in phagolysosome. In the phagolysosome, there will be production of the free radicals, reactive oxygen species and nitrous oxide, nitric oxide, which will degrade the microbial organisms and result in killing and degradation. So this picture is also showing the phagocytosis, chemotaxis and adherence of the microbes to phagocyte, ingestion of the microbe by phagocyte, formation of a phagosome. This phagosome when combined with a lysosome will result in formation of phagolysosome, and there will be digestion of the ingested microbes by phospholipase enzymes and other enzymes, and there will be formation of a residual body containing this indigestible material, and discharge of this waste material will happen after this process. So to conclude, events of acute inflammation are vascular events and cellular events. Vascular events mainly changes in blood flow and caliber, changes in vascular permeability. Cellular events, main events will be leukocyte recruitment and phagocytosis. Changes in the vascular flow and caliber. With the injury or stimulus, there will be first vasoconstriction, then vasodilatation, there will be increased blood flow, and because of this, rubor and color, increased temperature and redness. Changes in vascular permeability. Because of the vasodilatation, there will be increased vascular permeability, thereby exudation of proteins, fluid loss into the extravascular space, And because of the slow blood flow or stasis of the blood flow and concentration of the RBCs and increased viscosity, there will be engorgement of small vessels, that is tumor, swelling, there will be vascular congestion and redness. Margination, leukocytes will gather along the endothelial cells. Rolling occurs with the help of selectins. Expression of the selectin E and P by tumor necrosis factors, interleukin 1 and selectin P, histamine and thrombin. Ligand will be sialylated oligosaccharides. Adhesion will occur with the help of integrins. Rolling will occur with the help of selectins. Expressed by adhesions, integrins expressed by tumor necrosis factor and interleukin 1, and the ligand will be VCAM1 and ICAM1. Transmigration of the leukocytes or diapedesis is mediated by PCAM1, and the leukocytes move along the chemical gradient is called as chemotaxis, and the chemicals are called as chemoattractants. They can be endogenous or exogenous. Exogenous are released by the leukocytes, cytokines, complements C3A, C5A, leukotriene B4, and endogenous will be bacterial products. Phagocytic receptors, mannose, scavengers, and opsonins. Mannose phagocytic receptors will bind to the mannose and fucose, and phagocytic receptors bind to modified LDL particles, resulting in scavenging. And phagocytic receptors when bind to IgG and C3b complements, resulting opsonization. Microbes binding to one of the receptors, mannose or scavengers are opsonin receptors. Polymerization of the actin filaments will occur, resulting in change in actin myosin filaments, thereby extension of the cytoplasm into pseudopodias or pseudopod formation. Flows around the microbe and the plasma membrane pinches off to form a vesicle called as phagosome. Phagosome combines with lysosomes, resulting in formation of a phagolysosome. And in the phagolysosome, the enzymes are liberated because of the release of the lysosomal granules, and there will be killing and degradation of the microbes. All acute inflammatory reactions have one of these three outcomes. It may resolve or resolve. Complete resolution may occur, or healing by connective tissue replacement may happen. If it is not resolving or it is not healed, it will go into a state of chronic inflammation. With this, our topic of vascular and cellular events of inflammation completes. Thank you for patient listening. Please like, share, and subscribe Dr. Ravichandra Official for more interesting pathology videos.